fight? Hey, it's the word fight. We can't say that. Somebody might get upset with us. We can't upset anybody. Oh, I don't like that language. And I took it back and we talked about it. And some of my people were worried. I would say worried. I have a wonderful guy on my board, past board chair. He's a judge. He's such a thoughtful, good guy. I know when we're moving the needle, when he's looking really serious and worried. He gets that look a lot in the board. But it's okay, because he listens and he thinks he's very thoughtful. But when I heard that, I'm remembering a few years before that, Brian Gallagher standing up and saying, we have to put a stake in the ground. We have to stand for something. I remember going to Harwood Institute, and we joined the income mobilization in 2010, and the first thing we did is went to Harwood Institute, and I didn't understand why we were there in the beginning, but Rich Harwood is saying to us, we have to be able to stand on a table and say what's important to our community. That's advocacy. We have to do that. So I'm thinking about that, and I know our boards still struggle with it. I know people get worried. There's still a lot of thinking that we have to please everyone and be all things to all people. Well, if you don't stand for something, you stand for nothing, right? So I was thinking another example, recent example, Maroon 5 or Beyonce. We had the Super Bowl last week. We had all the controversy is, no one wants to do the Super Bowl, so who do they get? Well, they get Maroon 5. What do I hear about Maroon 5? Well, they're not going to offend anybody because they're just boring and they're bland. And so that's who we got because it was safe. Other than somebody like Beyonce, what does she stand for? Who's got the more passionate following? Who gets the attention? Maroon 5 or Beyonce? What kind of attention do we want to get? We want to stand for something? We have to stand for something. And we have to stand for something more than, we all want to be happy and build the common good, because how we get there is difficult. How we get there is more than funding a program. How we get there, we have to figure out how to build these systems. And we talked about the why earlier, and Aspen and I were talking about the why for us, it's the system. It's building the system, because programs will never ever get us where we need to go. In order to build systems, we have to talk to government leaders, we have to talk to business leaders, we have to help them understand why our work matters and how the policies they make, the things that they do, impact the lives of the people that they never see or hear from, because we talk to them. We, in 2009, were involved with Covering Kids and Family, and we still are. So we enroll people in healthcare. Well, what happens? 2010 Affordable Care Act. That was something very, very controversial. And our picture up here with Joe, I think any of you especially the northern part of the state, probably know Joe's outreach staff people. Young fellow's name? Jorge. Yeah, he came to see me right after that. And I was telling him what we do, and I said, we enroll people in healthcare, and now we enroll people in the marketplace, and we promote that a lot because it's really opened the door to a lot of people. And he looked at me and says, how do you talk about that without people getting upset? I said, you can do it. You can talk about it, because we're talking about what people need and why they need it. I have a friend from high school, and we are not on the same side of the political fence. And I remember having a conversation with him shortly after the Affordable Care Act, and he said, well, and he's self-employed. Well, now I have to buy this insurance and more insurance that I don't want, and everybody that I know is upset about this, having this marketplace insurance. And I don't support this at all. And I said, okay, let me tell you about what I see in my office. So we enroll people in healthcare. We have people coming in here who are getting health insurance for the first time, maybe ever or in years, and they're sitting at the desk and they're crying because they have health issues. And they're working, but they're working at jobs, 1 or 2 or more jobs. They don't have health care, they haven't had health care, they have these conditions, and now they can go to the doctor. Well, I've never heard anything like that, because that's not where he lives. So I talked to him last year or so, and he brought that up. He says, I remember you saying that to me. I never thought about it before, and he didn't forget it. That's advocacy. It's telling those stories to people so that they understand, then put a face on the people who the policies impact. So, going to the State House or going to Hill Day and talking to the representatives, the people that make the laws, is important. And it's important to do it in a respectful way, and from a way of, let us tell you how these things impact real people, and let us tell you the stories, and let us agree that we probably all want the same thing. But sometimes there are unintended consequences in policies. So let's think about, how we can do this better for everybody. There are things that when we went last year, we talked about SNAP. But we also talked about things like work requirements. That was part of SNAP. It's also part of On My Way Pre-K. It's becoming part of HIP. So these are things that are difficult for people, but you can have the conversations, and we need to have the conversations because we all want the same thing, but there are issues that are not getting people where they need to be. So it's important for us to be that voice. If we're not that voice, who's going to be? Our clients aren't going to go talk to the representatives. Our clients are just trying to survive. So they need to hear it from us because we are talking to the people. Which brings me to Alice. What a fabulous tool. I first heard about Alice, I think, in 2011, because we were in that income mobilization, and Northern New Jersey, right? They were the ones that invented Alice. And we're like, oh, that's really cool. Because it gave a name and a face to the people that we were trying to help. And when it was brought to the state to do it, it's such a fabulous tool. If you're not using Alice, you're just missing the boat. Because what does Alice do? It puts a face on our work. When we say we fight for the health, education, and financial stability of every person in every community, it's Alice. Or in our community, it's Destiny, it's Liza, it's Tony, and we've got a bunch more names. So what has happened now that we talk about these are real people and their real struggles, and people begin to think, oh, it's not about me, it's not about our organization, it's about the people at the end, and that kind of starts overcoming the issue we've had as United Way for many, many years. What do you do? What do? We help Destiny. Destiny's got a job. Her child is in child care. He had some speech issues. He got therapy. Destiny's now enrolled in nursing school. This was a mom who had no job, who had no education, whose husband left. She had a toddler. She didn't know what she was going to do. And now she's going to be an RN. And she's employed. That's powerful. Powerful work. What happens when you start talking that way? People, I want to be part of that. We have a Women United initiative now, not because we thought of it, but because one of our donors said, hey, I heard about, because she works in Indy, they have that here, why don't we have it? I was a single mom. I have a lot of friends who were single moms. Destiny's a single mom, Liza's a single mom, you've been telling these stories, I want to help them. I want to help them get to where I am today. So it just kind of happened. And it wasn't program, it wasn't anything more than getting that real connection with people, and that's advocacy. And sometimes it's about policy, sometimes it's about programs, sometimes it's about giving, but it's about helping people understand what real needs are and how we can help and how we can make systems so that people can succeed over time. Because we are that bridge where we have the voice of businesses, we have the voice because we have this big network, we have the ability to go have these conversations, and it's our responsibility to do that. So even if it's scary, go talk to your cohorts. And a lot of times when we talk in public policy committee, we're looking for who's with us and how do we frame that. We don't need to be contentious about it, but we need to tell people what we know. Harwood, you do the community conversations, and Rich says you stand on the table. Why can we do that? Because we know. We know because we talk to people, because they tell us, because we work with them, because we see it. And we have Alice data, so we also know from the expert side. We bring those things together, so we've got the on the street, we've got the expert, we have the authority. People look to us. And when they look to us, what's happened in our community is we get called. Corporation for Economic Development, he's thinking about looking what kind of businesses to go recruit. He calls me. And he asks about what we're doing with workforce development. And we have these conversations. So now sometimes you're going to get called when you may not want to be called, because some of you may have heard about